Hi, I'm Jennifer Ott. I'm a physical therapist with Commonwealth Orthopedics. Today we're going to talk a little bit about workstation setup. A lot of patients come to us with orthopedic issues, yet they have no specific method of injury, but they do sit at a desk 8 or more hours a day. So we really need to take their workstation setup into account when we're treating them. So an ideal workstation setup is going to promote an upright but relaxed posture. What that means is your head's going to be pulled back over your body. Shoulders are back but down and relaxed. Elbows at 90 degrees with your wrists in neutral. Hips and knees at 90 degrees, feet flat on the floor while maintaining your low back curve. So how we go about doing that is, first let's talk monitor placement. Monitor really needs to be directly in front of you at eye level and not too far away. If it's too far away, patients are going to strain to see it. The head's going to migrate forward. What that does is cause undue stress on the lower part of the neck and neck pain. If the monitor is not directly in front of you but off to one side or the other, you end up with your neck in a rotated position for hours on end. It's going to cause joint restriction, muscle restriction, and cause you neck pain. So again, directly in front of you at eye level and not too far away. Keyboard should be right about elbow level. It allows you to keep your elbows bent to 90 degrees with your wrists in neutral. Wrists in neutral means as straight as you can keep them, not cocked up too high or bent down too far. Either of those positions will stress the muscles and the nerves that travel along your wrists. So elbows at 90 degrees with your wrists as neutral as possible. As for mouse use, you want it as close to you as possible so you can really maneuver to and from the mouse easily without repetitively straining your shoulder reaching for it. For patients who are on the mouse a lot, we'd recommend they switch sides, alternate right and left, so again, you're not using the same arm over and over to reach for it, but just right here close by you. Next, for chair height, an adjustable chair height is key. It's going to allow you to achieve that 90-degree hip and knee angle with your feet flat on the floor. If the chair does not go low enough for a patient, we would recommend they put a step stool under their feet to bring them up to that 90-degree angle. If the chair does not go high enough for a taller patient, they're going to need to sit on something like a pillow or a booster to take them up to that 90-degree angle. Again, hips and knees at 90 degrees, feet flat on the floor. To maintain your low back curve, a lot of times we would give patient some type of lumbar roll to help cue them to sit upright. So just put it in the low back position. It helps you get an upright posture and hold that throughout the day. You don't necessarily need this. You can use a rolled up towel or rolled up blanket, anything to serve as that tactile cue to get you upright. For patients who are on the phone a lot, a headset is key. A headset's going to allow you to keep your neck in neutral while you talk on the phone. If that's not an option, same thing as the mouse, we would recommend you change the phone position. So it's not always on the left or always on the right, but rather you alternate. These are just some things to start taking into consideration if you are someone that sits at a desk all day long. If you have any muscle or joint pain that persists, we would recommend you see an orthopedic physician to get yourself evaluated. Thanks for watching.